Are you curious about what Zofran is used for? In this video, we will explore the common uses, recommended dosage, potential side effects, and user experiences of Zofran. Whether you've been prescribed this medication or are simply interested in learning more about it, we've got you covered. Common uses of Zofran. Zofran, also known by its generic name ondansetron, is a medication commonly used to prevent nausea and vomiting caused by chemotherapy, radiation therapy, and surgery. It belongs to a class of drugs called antiemetics, which help to control these symptoms effectively. Chemotherapy-induced nausea and vomiting, CINV, can be debilitating and significantly impact a patient's quality of life. Zofran is often prescribed to patients undergoing chemotherapy to help manage these distressing side effects. It works by blocking serotonin, a neurotransmitter in the brain that triggers nausea and vomiting. In addition to CINV, Zofran is also used to prevent and treat nausea and vomiting associated with radiation therapy and surgery. Some surgical procedures, such as those involving the digestive system or inner ear, can induce post-operative nausea and vomiting, PONV. Zofran can be administered before or after these procedures to reduce the likelihood of experiencing these symptoms. How does Zofran work? Zofran works by selectively blocking the action of serotonin in the body. Serotonin, a neurotransmitter, plays a crucial role in regulating various bodily functions, including mood, appetite, and nausea. When certain triggers, such as chemotherapy drugs, radiation, or surgery, stimulate the release of serotonin in the gut and brain, it can lead to nausea and vomiting. By blocking serotonin receptors, Zofran helps to inhibit the signaling pathways that trigger these symptoms. This mechanism of action allows Zofran to effectively prevent and treat nausea and vomiting associated with various medical treatments and procedures. It's important to note that while Zofran is highly effective for many individuals, it may not work for everyone. If you are prescribed Zofran and do not experience significant relief from your symptoms, it is important to consult with your healthcare provider to discuss alternative options. Recommended dosage of Zofran. The recommended dosage of Zofran can vary depending on the individual's age, weight, medical condition, and the specific treatment or procedure being undergone. It is crucial to follow the prescribed dosage provided by your healthcare professional and not exceed the recommended limits. For adults and adolescents aged 12 years and older, the usual recommended dose of Zofran for preventing CINV is 8 mg taken orally or intravenously 30 minutes before the start of chemotherapy. Additional doses may be prescribed for subsequent days, depending on the duration of the chemotherapy regimen. In cases of radiation therapy-induced nausea and vomiting, Zofran is typically administered at a dosage of 8 mg orally or intravenously, 1 to 2 hours before the start of the procedure. Additional doses may be prescribed for subsequent days if necessary. For the prevention and treatment of PONV, Zofran is usually given in a dosage of 16 mg orally or intravenously 1 hour before surgery. It may also be administered as a single dose of 4 mg intravenously immediately before anesthesia induction. It's worth mentioning that dosage adjustments may be necessary for individuals with impaired liver function or those who are elderly. Always consult with your healthcare provider to determine the appropriate dosage for your specific situation. Potential side effects of Zofran. As with any medication, Zofran can have potential side effects. While not everyone will experience these side effects, it's essential to be aware of them and consult with your healthcare provider if you have any concerns. Common side effects of Zofran include headache, constipation, and fatigue. These side effects are generally mild and may resolve on their own without any intervention. However, if they persist or become bothersome, it is advisable to discuss them with your healthcare provider. In some cases, Zofran may cause more severe side effects. These can include allergic reactions, such as rash, itching, or swelling of the face, tongue, or throat. If you experience any of these symptoms, seek immediate medical attention as they may indicate a serious allergic reaction. Zofran can also affect the electrical activity of the heart, resulting in changes on an electrocardiogram, ECG. This is more likely to occur in individuals with certain pre-existing conditions or those taking other medications that can also affect the heart's electrical activity. It is important to inform your healthcare provider of any existing medical conditions or medications you are taking before starting Zofran. User experiences with Zofran. The experiences of individuals who have taken Zofran can provide valuable insights into its effectiveness and potential side effects. It is important to note that everyone's experience with medication can be different, and what works for one person may not work for another. Many users report positive experiences with Zofran, stating that it effectively controls their nausea and vomiting, allowing them to continue with their chemotherapy, radiation therapy, or recover from surgery without significant disruptions. These individuals often express gratitude for the relief they experience from this medication. However, there are also users who have reported limited effectiveness or inadequate relief from Zofran. Some individuals may require alternative medications or treatment options to effectively manage their symptoms. It is crucial to communicate openly with your healthcare provider if you are not experiencing the desired results with Zofran. Precautions and considerations when taking Zofran. Before taking Zofran, it is important to inform your healthcare provider of any existing medical conditions, allergies, or medications you are currently taking. Zofran may interact with certain medications, including those that affect the heart's electrical activity, such as certain antidepressants or antiarrhythmics. Your healthcare provider can determine if Zofran is suitable for you and make any necessary adjustments to your treatment plan. Additionally, pregnant or breastfeeding individuals should exercise caution when considering the use of Zofran. While studies have not shown a clear link between Zofran and birth defects, it is crucial to discuss the potential risks and benefits with your healthcare provider before starting this medication. Alternatives to Zofran. While Zofran is a commonly prescribed medication for the prevention and treatment of nausea and vomiting, there are alternative options available. Some individuals may not respond adequately to Zofran or may experience side effects that necessitate the exploration of different treatment options. Alternative antiemetic medications, such as compazine, prochlorperazine, or Reglan, metoclopramide, may be prescribed in certain cases. Non-pharmacological approaches, such as dietary adjustments, relaxation techniques, or acupuncture, may also be considered as adjunct therapies. It is important to work closely with your healthcare provider to determine the most appropriate treatment plan for your specific needs and circumstances. Consultation with a healthcare professional. This video provides an overview of Zofran's common uses, recommended dosage, potential side effects, and user experiences. However, it is crucial to consult with a healthcare professional for personalized advice and guidance. Your healthcare provider will consider your individual medical history, current medications, and specific treatment requirements to determine the most appropriate course of action. They can address any concerns or questions you may have and ensure that you receive optimal care. Conclusion and final thoughts. Zofran is a widely used medication for the prevention and treatment of nausea and vomiting associated with chemotherapy, radiation therapy, and surgery. It can provide significant relief for many individuals, allowing them to better manage these distressing symptoms. Understanding the common uses, recommended dosage, potential side effects, and user experiences of Zofran is essential for anyone considering or currently using this medication. By being informed and working closely with your healthcare provider, you can make informed decisions about your treatment plan and ensure the best possible outcomes. Remember, this video is meant to provide general information and should not replace professional medical advice. Always consult with a healthcare professional for personalized guidance tailored to your specific circumstances.